Some patients suffer only from angioedema, but not from wheals. Is this urticaria too?
Isolated angioedema, that is, you develop these swellings but you don't have the wheals, is not typical, but it is one way to have urticaria. I'd say that 1 in 10 patients with chronic spontaneous urticaria has isolated angioedema, never develops wheals, never is itchy, but gets these stupid swellings of the lip, of the eyelids, of the hand, of the feet that last for a couple of hours to a couple of days and can be very annoying, very disabling. So this is urticaria as well. Same underlying causes, the same response to the same treatment, just a different way of showing itself.
What is urticaria pigmentosa?
Urticaria pigmentosa is an old name for skin mastocytosis. That's what we used to call it because in this disease, in this mastocytosis, there are also wheals at skin sites that are brownish colored. So that's where the name comes from, but it's a completely different disease. Mastocytosis is more mast cells in the skin and symptoms because of that. And so we don't use that name anymore because sometimes it gets confused. Urticaria, urticaria pigmentosa. Best to use the word or the name skin mastocytosis in these patients or for this disease.
What can patients do if their tryptase value is elevated?
Tryptase values can be elevated for a lot of reasons. Sometimes it's just something that you see when you look for it. Sometimes we want to know if tryptase is high. This is especially true for patients where we suspect some form of mastocytosis. So this is not really relevant for urticaria patients, and if tryptase comes up positive or high, then other causes for this should be looked for. It's not one of the routine measurements and blood tests that should be done for urticaria.